Government Degree College for Women, Autonomous Karimnagar, Jignasa Student Study Project, Department of Zoology, Prevalence of Diabetic Cardiovascular Complications by Humera Sultana BSc BZN second year and my team members.
O Chandana BSc BZAN second year. D Sandhya BSc BSc second year. N Archana BSc BSc second year.
D Devika BSc BZB second year. K Shrija BSc BZAN first year. Under the guidance of Y Narayana sir, lecturer in Zoology. Introduction, contents, introduction. Review of literature, methodology, results and discussion, conclusion. Introduction. What is cardiovascular diseases? How diabetes affects your heart? What is diabetic cardiovascular diseases? How can we prevent? What is the present study? To study the relationship between the dietary habits causing diabetes which leading to the damage of heart, causing heart attacks. Now Chandana will continue.
Review of literature. The literature available on the bottom so far in India and in abroad was reviewed as per the objectives of the present study and has been presented here. Elisa Dalcanto in 2020 reported that diabetes is a significant risk factor for cardiovascular diseases and the people with diabetes are a higher risk for developing CVD including coronary artery disease, heart failure and heart stroke. Uncombis was in 2022 during the study one of the primary mechanisms linking diabetes to CVD is insulin resistance and hyperglycemia. It can also lead to endothelial dysfunction, inflammation and atherosclerosis. Next, Chandana will continue.
Methodology. The study was conducted on a total of 100 heart disorder patients, selected randomly from various medical institutions such as Prathama Medical Sciences, CAIMS City Hospital and Reading Hospital of Karimnagar, district of Telangana. A comprehensive and questionnaire was populated, specifically keeping in the mind the objectives of the study. The patients were interviewed to collect information with detailed family and dietary history, with the added information about his or her food likes or dislikes, prevalences or intolerances, eating habits, gender, meal pattern and dietary intake. Added information about dietary modification in relation causing heart disorders such as foods are especially taken or avoided, consumption of sugar and salt, fast foods, high cholesterol foods and carbohydrates also collected. Information on food preferences of patients, frequency of consumption also collected. In addition, the patients are inquired they have type 1 or type 2 diabetes, which addition risk factors of health. Now Vedika will explain.
Objectives. Having diabetes means is more likely to develop heart diseases. People with diabetes also have certain risk factors such as high blood pressure and high cholesterol level. It increases the chance of having heart diseases and heart attack. If you have diabetes, you can protect your heart and health by managing your high blood glucose and such as blood sugars. You can also protect yourself by controlling your high blood pressure and high cholesterol. If you smoke, that helps to stop. What is the link between the diabetes and heart diseases and stroke? High blood glucose from diabetes can damage your heart diseases and it leads to damage the heart diseases. People with diabetes and their heart disease at earlier age than people without diabetes. My friend will continue Sriga.
And the cause of diabetes is diabetic cardiomyopathy and diabetic nephropathy and coronary microvascular dysfunction and coronary artery diseases and hypertension, and this leads to the symptomatic heart failure. And there is people with the diabetes are twice likely to develop the heart stroke or heart disease or stroke, and causes high blood sugar levels from the diabetes. It can damage the heart and nerves, and it increases in the risk of heart diseases, and it includes high blood pressure and overweight. And my friend Archana will continue.
Symptoms: breaking out in a cold sweat or having clammy hands for no reason, feeling lightheaded, feeling tiredness for no reason, heartburn, pain in your jaw, neck or left arm, stomach upset, shortness of breath. Key factors contributing to CVD and diabetes. People with diabetes are at higher risk to developing cardiovascular diseases. The people without diabetes, the common types of CVD in people with diabetes includes insulin resistance and hyperglycemia, leads to the endothelial dysfunction, inflammation and atherosclerosis. Glycemic control, targeting HbA1c levels to reduce cardiovascular risk. Blood pressure management, controlling hypertension to reduce cardiovascular risk. Lipid management, managing dyslipidemia to reduce cardiovascular risk. Lifestyle modifications, encouraging healthy lifestyle habits such as regular physical activity and a balanced diet. Next, Sahitya will continue.
Prevention. To prevent heart attacks, people with diabetics can control blood sugar, blood pressure and cholesterol levels, stop smoking, get regular physical activity, monitor the sugar levels regularly, take medicines as prescribed. Next, my friend Humera will continue.
Results and discussion. When we examine 100 cardiovascular patients, 70% are resulted as diabetic. As a result, people with diabetes are more prone to cardiac heart diseases. In the 70% of diabetic patients, 5% are type 1 diabetic and 65% are type 2 diabetic. Rest of 30% is diagnosed with other health issues. Food chart for the diabetic patients with cardiac heart diseases: taking low carbohydrates, avoiding high cholesterol foods such as junk food and fast food, proper exercise, managing sugar levels, maintaining regular checkups may decrease the complications and lead to a healthy life. Now Sahitya will continue.
Conclusion. The patients with diabetes are more prone to the cardiovascular diseases. Early detection and prevention of the diabetes and managing our lifestyle with good dietary habits may decrease the chances of cardiovascular risk factors. As we know that prevention is better than cure. Thank you.